Hey, Mark Stewart here again, and I have one more thing for you with our workshop coming up here very soon. I'm really excited about the back pain and sciatica workshop, and I know you're going to get a lot out of it. Again, you're going to get to see natural healing treatment and what that looks like without medications, injections, and surgery. You're going to get to hear stories from other people who are back to normal again and got their life back, and now they can walk, sit, and stand. They can do everything they want to do without pain. So really cool stuff, and I'm super excited and looking forward to it. Also, I have something that I want to share with you here today, and that's the most common thing that we see with regard to the cause of back pain. Now, in the back pain and sciatica workshop, I'm going to share with you the 3 common causes of back pain and sciatica. However, this one thing is about 90% of the people that we see in the workshop. So, it's arthritis, stenosis, and disc degeneration. And today I want to share with you exactly how that works to see if this fits you or not. Now, we know blindly that at 50 years of age or older, if you have pain with standing or walking that goes away when you sit down, or if you've ever heard yourself say, I just need to sit down for a minute, then your back pain and sciatica goes away, then there's a 99% chance that this is what's going on. So this is how this works, and I drew this out ahead of time. So what is this here? This is a vertebrae. It's a bone in your back. The most common level for arthritis is L4 and L5. Now, maybe you've had an x-ray already, maybe you've had an MRI already. You don't need those things to come to the workshop or anything like that. But if this is a bone and then this is a bone, then what is this structure here? This is your disc. And what happens is, as we age, like right now, if you're over the age of, let's say, 50, compared to the time when you were 25, are you taller now? Or are you taller when you were 25? Well, likely it is that you've shrunk as you've aged. So you were taller at 25 than you are now. But there's 2 reasons that we shrink. One is a breakdown in posture. The second is the space between these vertebrae, right here, well, that shrinks down. We lose fluid in there, so we lose height. And as a result, we shrink. Now, the one joke that I normally tell in the workshop is that I used to be 6'3", and now I'm only 5'10". Now, that's 100% not true, but for the most of us, we will lose between a ½ inch and an inch between the time that we're 25 and the time that we turn 65. Anyhow, that's caused by age. What happens that leads to arthritis, stenosis, and disc degeneration is this. When that space shrinks down, the hole where the nerves come out, right here, this is your spinal cord coming out. It's a bundle of nerves, and you have nerve roots coming out. And what happens is that hole shrinks down. Now, when that happens, that pinches on the nerves, which creates problems. Now, I drew this for a person facing that way. But typically, when you see somebody suffering with this, here's what they look like. If you've ever seen them at Target or Costco walking through the store, they grab the grocery cart and they lean forward as they're walking through. And the reason that they're doing that, the reason that they're leaning forward, is because it opens up the space. So they have pain when they stand or they walk, and they can't lean back or stand up straight because the space closes down and it pinches on the nerves. Really, really simple, but that's how it works. So that is the number 2 common cause for back pain and sciatica. It's stenosis, arthritis, and disc degeneration. And that's how it works. And at the workshop, I'll share with you exactly what natural treatment looks like specifically for this. I'm looking forward to seeing you there.